Hey everybody, how's everyone doing today? Let's see. Can you hear me? Hello everyone, how's everybody doing? Let me, don't know what just happened to my music, but that's okay. Technical things happen, right? All right, hold on one second here. Yeah, it's working. Okay. Let me just share this video so we can get started, all right? All right. How's everybody doing today? Well, I hope. Let's see. All right, well, everybody, how's everyone doing today? It is Sunday, March 4th. It is 3:11 p.m. and it is time for Talk with the Doc. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I help pastors and busy professionals, folks who are overworked, overwhelmed, and overweight to transform their minds, bodies, and spirits so that they can have a greater impact on their children, congregations, and communities. Thank you so much for joining me today for our weekly Talk with the Doc. I'm going to ask you guys to do one thing today, okay? One thing. I need you to go to 12secrets.net. That's 12, the number 12, 12secrets.net, and download my book. It's for only $2.99 if you haven't gotten it yet. The 12 Secrets of Divine Health. It is available now, right? It is an Amazon bestseller. Thank you all from the bottom of my heart for all of you that have purchased the book. But if you haven't gotten it, go ahead and get your copy today, all right? Like I said, it is March 4th. So, you know, each month the different cancer organizations do a awareness. And so the month of month of March actually has two awarenesses that we're going to tackle this month. And the first of which is colorectal cancer. All right. So the colon and the rectum and the cancers that affect those areas. And so March is the month that we highlight and want to bring awareness to colorectal cancer. All right, so what is colorectal cancer? Like everybody's like, colorectal cancer? I never heard of that. You actually have. It's colon cancer. I'm sure you've heard of that. Colon cancer is one of the, unfortunately, it's the second highest cause of death in America when it comes to cancers. All right, so the second cause of death, for cancer-related deaths in America. So second, that's a lot, right? So how many people have colorectal cancer? In 2012, there were 1.4 million new cases, all right, and over almost 700,000 deaths from the disease, all right. Now, we know that developed countries, first world countries, the United States, America, we have more than 65 cases of the colorectal cancers, all right. We know that it's more common in men, but we do see it in women as well, all right? So everybody needs to get screened and tested for it. The colorectal cancer is one of those cancers that can be, if caught early, it can be treated, all right? So it's one of these, we almost want to call it a preventable cancer, because with all the screening that we do now, we can catch it early and we can get rid of it, all right? So this is one of those cancers that if you get your screenings the way you're supposed to, you probably won't have that. Hey, Miss Nikki, thanks for joining in. I appreciate you. Thanks for watching today. Please share this video so that everybody can learn about colon cancer, all right? So we know that the 5-year survival rate for colon cancer in the United States is around 65%. So like I said, this is one of those cancers, we're catching it earlier and we're treating it earlier, so people are surviving longer with it, all right? So what is colon cancer? Let's talk about that. Colon cancer is it is cancer that's found in the colon and the rectum. All right, so let me just show you a picture of that part of the body. Ooh, there we go. All right, so we got the stomach here, and then we've got all of the intestines, the large intestine there. All right, and this is the colon. Okay, this part here at the end, and then the rectum is the bottom part before it comes out. All right, so these are cancers that affect the large intestine, or the colon, and then the rectum. All right, and we know that the colon cancer, it starts off, most of the time it starts off as a polyp. Okay, and a polyp is usually a benign or non-cancerous small little tumor or growth in the colon, that if it's left there, it can turn into a cancer. It can develop into a cancer. All right, so what are we telling folks to do? We want to catch them while they're still benign or non-cancerous polyps. All right, so we want to catch them early before they turn into a cancer. And that's why I said colon cancer is one of these preventable cancers, all right, preventable deaths in most cases, because we can catch it, we can find the polyps early, and we can get rid of it. So how do we find the polyps? Well, first, before we get to the screening, let's talk about the symptoms. Colon cancer is one of these diseases that really, sometimes you don't have a lot of symptoms. And so that's why we want people to get their screenings on time, because sometimes you don't have symptoms. But if you do have symptoms, some of the symptoms that you can get blood in the stool. That's the main thing. So if you are having your bowel movements, if you're using the bathroom, doing number 2, as they call it, and you're seeing blood in the stool, blood in your poop, okay, whether that's blood on the tissue when you wipe, or blood actually in the poop, or blood in the toilet, you need to go see your doctor sooner than later. Don't wait. Don't just assume that it's a hemorrhoid. Don't just assume, okay? We want to know for sure what's causing that blood in the stool, because it shouldn't be there, all right? If you have mucus in your stools, if your stools are really smelly, like smellier than usual, all right, mucus and blood and really, really bad odor to the poop. I mean, we all know no poop smells good, right? But if this one smells even worse than usual, then that could be a sign that there's something going on in your colon, and we need to get that checked out. All right, so we need to get that checked out. So what, also weight loss, so unexplained weight loss. If you're not changing up your diet, you haven't changed up your exercise routine, and you're suddenly losing weight without cause or without reason, we will need to look and investigate to make sure that there's no colon cancer, okay? And then if you have, let's see, there's another one. A change in your bowel movement. So you're used to going every day, same time of day, every day, same amount every day, and then it changes. All of a sudden you get more constipated than usual, or all of a sudden you're going more frequently, or you've got diarrhea for a really long time, or loose stools. If you've had a change in your bowel pattern, then you need to go and see your doctor, all right? Also, if you're feeling tired and fatigued, and you can't figure out why, you're getting enough sleep, but you're still feeling tired and fatigued, one of the other workups that we do is to get a colonoscopy to make sure that there's no colon cancer. All right. So what causes colon cancer? In most of the cases, it's just something that happens as we get older. All right. So in a high percentage, it's something that occurs as we get older. That's why as you get older, we want you to get the screening. All right. We'll talk about that in a moment. There are some family genetic traits that can cause more polyps than usual. There's a lot of multiple different diseases that can cause a genetic predisposition to getting more polyps than the regular amount of people, right? So if you know someone in your family, so we call first degree relative, so a father, a mother, a parent, or a sister or brother, or a cousin, aunt and uncle that have had, I'm going to tell you that, Nikki, I'm going to tell you when you should get your colon checked. But if you have a cousin or a first degree relative, cousin, parent, aunt, uncle, brother, sister, then you need to get your colonoscopy and your colon checked earlier than most people, okay? So let us just go right into that. So when should you get your colon checked? Typically, it's at age 50. That's when we encourage people to get screening. Now, if, like I said, if you have a family member that has had it, then you need to get it 10 years prior to when they got the cancer. So let's say that they got their cancer at 45, then you need to get your colonoscopy at 35, okay? If they had their cancer at 55, then you need to get your colonoscopy at 45, all right? So 10 years before someone in your immediate family was diagnosed with cancer, that's when you should get checked. Everybody else, it's age 50. Now, back in 2016, they came out with some new guidelines. We do know that the colon cancer, it occurs more in men, like I said, but it also occurs in women. Now, when it occurs in women, usually it's a little bit more aggressive. And so what they've also found is that in African Americans and Hispanics, colon cancer rates and numbers seem to be higher. So they really encourage men, especially African American men, Hispanic men, to get your colonoscopy at age 50. But back in 2016, they actually recommended that women, African American women and Hispanic women, actually you need to get started getting with your colonoscopy at age 45. All right, because we're seeing more aggressive forms of colon cancer in women, African American and Hispanic women. So, ladies, 45. All right, mammograms at 40 typically. Now colonoscopy at 45. Don't wait until you're 50. Now, you do need to check with your insurance because some insurances won't cover it until you're 50. Like I said, this is a fairly new guideline that just changed. And so when the guidelines recently change like that, sometimes insurance companies don't stay up on that. So check with your insurance company first. But what you need to do, ladies, call your insurance company, find out if you're 45, African American, find out if your insurance company will cover it. And if they will, go ahead and get your colonoscopy at age 45. All right. So that brings me right up to how do we screen for colon cancer? We get a colonoscopy. What is a colonoscopy? A colonoscopy is when they basically put a camera up into your rectum and they look around. Hey, Miss Penny, thanks for joining in. I appreciate you. Please share this video. Thank you so much. They put a camera up into your rectum and they look around. All right. So let me show you a picture of a colonoscopy. Okay. So you see that's the colon, and then that thing that's in there is called a colonoscope. Okay, it's a camera basically that goes into the rectum and it looks around. Now, colonoscopies are painless, all right? So people are like, oh my God, I don't want to get a colonoscopy. It's going to hurt. No, it doesn't really hurt. First of all, they give you medication to make you sleepy and so that you don't remember it. It kind of gives you what we call retrograde amnesia so that you don't really remember what happened. Somebody actually needs to drive you to your colonoscopy because you'll be too woo to drive yourself home, okay? So you'll be asleep most likely, or you'll be really copacetic, you know, kind of cool, calm and collected, so you won't feel a thing. All right, they're not painful. They use plenty of lubrication and you won't feel it. All right. Usually a colonoscopy takes anywhere between 15 to 20 minutes, if that long. Okay. And what they're doing, a colonoscopy is actually going to go in and it's going to check your whole, the rectum, which is down here at the bottom. It's going to go around, it's going to check the entire colon, the left side of the colon and the right side of the colon. All right, so let me explain. A colonoscopy checks the entire colon from the rectum all the way to the end, which is called the cecum. That's where your appendix is located. All right, so it checks the whole thing. Now, there's also another way you can get screened with something called a flexible sigmoidoscopy. All right, a sigmoidoscopy, which is actually what this is a picture of. The sigmoidoscopy stops right here. Okay, at this the left. It's where the basically the colon takes a turn. That's where the sigmoidoscopy stops. Now, we do know that about 60% of most cancers are found in the left side of the colon. So you're going to catch 60 to 65% of the cancers with the sigmoidoscopy. But if you were in that 30 to 35% that has it in the right side of the colon, then a sigmoidoscopy is not going to catch it. All right. So you really should be getting a full colonoscopy, but if you can't get a colonoscopy, then a sigmoidoscopy would be okay too. All right. So, like I said, they're painless. All right. They're quick, and you should get them. Now, if the colonoscopy is normal, guess what? You're good for 10 years. 10 years, right? 10 years, and you're good to be screened again, unless there's a family history, or you have a change in the bowels, or you have blood in the stools, or one of those other reasons. Then we would have to repeat it. But if it's normal and you haven't had any changes, no other problems, then you are good for 10 years. All right, 10 years. If there is something abnormal, if they find a polyp, which is, like I said, those benign or non-cancerous lesions that they're going in there to remove, then they might want you to repeat it anywhere between 3 to 5 years, depending on how many polyps they find and with the size of the polyps that they find. Let me show you a picture of a polyp, all right? So this is a colon, okay? And inside the colon, it's a tiny little, like a little blip, like a little pimple inside of your, hey, Miss Mary, thanks for watching, inside of your colon. And so when they see that, that polyp, there's a little device on the colonoscopy, and it basically snares it, it grabs it, and it takes it off and it removes it. All right. If it's a very large polyp, they'll leave a little marker so that they can always see where they removed it from. All right. If it's just a small one, they'll just remove it and it's good. Then they send that off to the lab and find out if it's cancerous or not. All right. If it's cancerous, like I said, you're going to we'll talk about treatment here in a moment, but if it's not cancerous, like I said, we'll repeat it anywhere between 5 and 10 years, usually 10 years if it's a normal colonoscopy. All right. So what happens if they do find out that it's cancerous? If they do find out that it's cancerous, usually what they're going to do, like I said, they've already gone in and removed the polyp, but if they send that polyp off and they find out that that polyp was cancerous, then they're going to do, depending on how deep the polyp was, how deep the cancer is, they got to go back and do some staging, which is the cancer just right there on the inside lining of the colon? Has it extended into the muscle, or is it had it gone all the way through to the outside lining of the colon, or has it spread to other areas of the body? All right, so that's what we call staging of cancers. It's T staging. There's T 1 through 4 basically, and based on that, they can decide, do they just want to go in and remove a section of the colon, just a small section. They remove that section and then reattach it, and you're good to go. All right. And then sometimes, very rarely, they do chemotherapy. Usually they reserve chemotherapy only if the cancer has spread or metastasized. That means it's spread to other areas of the body. That's when they do chemotherapy. But most of the time, they're just a surgery to remove that portion of the colon that was affected, and then you're good to go. All right. Now, you'll, of course, be having very close following and you'll be followed closely with other colonoscopies. Oh, thank you, Miss Avia. Guess what? I am actually in a hotel lobby, and so they're playing the music. But I will add that disclaimer: I do not own rights to this song. Can you guys hear? I guess that means you guys can hear the music. I'm sorry, but you're right. I don't own the rights to this song, and I will add that to the beginning of my talk here. So last but not least, prevention. It's all about prevention. So what can we do to prevent colon cancer? Like I said, most of the time it just happens as we get older, but we have found that diet and exercise, smoking, and your weight do play a part. So absolutely, thank you, Miss Avia. Thank you. Thank you. I appreciate it. Yes, I do love to give you guys knowledge. So first things first, diet. They find that if you eat more fruits, more vegetables, less red meat, that you will have a less chance of getting colon cancer. All right, so more fruits, more vegetables, and more fiber. Guys, we got to be eating our fiber. What does fiber do? Fiber moves that poop through the colon, all right, and keeps us regular, all right, and keeps our bowel movements regular, and it lowers our risk of cancer. So eat your fruits, eat your vegetables, eat your fiber, lessen on the red meat, all right, and then drinking more water. I know, right? Can you believe it? Yes, they say that if you drink at least 5 glasses of water a day, that lowers your risk of getting colon cancer. Why? Because water helps to make the poop more soft and more friable so that it can move through the colon better. You don't want all that toxic stuff sitting in your colon for a really long time, all right? You want to be able to move that out and get rid of it, all right? When you eat, you should be able, really should go to the bathroom. The problem is we're eating not healthy stuff, and so it just kind of sits around in our colon. If we actually all went and looked at our colons, they'd be actually kind of gross, all right? So colonics are actually a good thing. We'll talk about that another time, though. All right. Also, obesity, and sedentary lifestyle and lack of exercise, we're finding that that increases your risk for colon cancer as well. So you guys, guess what I always tell you? It's time to get moving, right? You got to get out there and got to exercise, got to get moving. All right, smoking also increases your risk of colon cancer. So if you are a smoker, like Dr. Nicole always says, please stop it. Cut it out, okay? Let me help you, or find somebody who can help you quit smoking, because it increases your risk of colon cancer. All right. So you want to eat more fruits and vegetables, less red meats, drink more water, exercise more, and stop smoking. That will lower your risk of colon cancer. And then last but not least, guys, go and get your colonoscopy. I promise you, it can save your life. All right. It can save your life. If you're age 50, you need to get one. If you're an African American female and you're 45, call your insurance company and find out if they'll pay for you to get one at 45, because they have lowered that age down to 45 for us. And then if you have a family history of colon cancer, then you need to start 10 years before that person was diagnosed. All right. So that's a little bit about colon cancer. It's, like I said, it's March. It's Colorectal Cancer Awareness Month. And so we want to do all we can do to prevent colon cancer. So if you guys go to 12secrets.net, that is where you can get my book. And in my book, I talk about all of these things, about how to when to schedule your colonoscopy, about how much water you should be drinking, how to eat better, how to exercise more, when you should see your doctor. All of these things are in the book. There are multiple secrets of the 12 Secrets to Divine Health. All right, so go to 12secrets.net and get that book. All right, it's a great book, a great read, and it will help to improve your life so that you can live an abundant life. All right, well, guys, I need to go, but I really enjoyed talking with you today. Listen, like I said, for the rest of this month, we are gonna. It's March is Colorectal Cancer Awareness Month. It's also Renal or Kidney Cancer Awareness Month. So one of these weeks, we're going to talk about kidney function and renal cancer, renal carcinoma as it's called, and we're going to talk about that this month as well. All right. Well, thank you guys for joining me. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I help pastors and busy professionals who are overworked, overwhelmed, and overweight transform their mind, body, and spirit so that they can have a greater impact on their congregations, children, and communities. Thank you so much for following me and for joining me with, yes, Miss Avia, thank you, 12secrets.net, absolutely. Thank you so much for following me and joining me for Talk with the Doc. I will see you next week at 3 p.m. Eastern Standard Time. We might talk about renal carcinoma next week, and then March is also multiple sclerosis awareness, but I think we're not going to do that next week. I think we're going to do that in 2 weeks. But join me next week, and I'll let you know what we're going to talk about. All right. So next week for Talk with the Doc, 3 p.m. Eastern Standard Time. Go get my book, 12secrets.net, and I will see you all next week. Bye-bye. Hey, Miss Penny, thank you. Hey, Superior, thanks for joining in so much. Talk to you guys later. Have a good one. Bye-bye.